Hi, I'm Dr. Johnny, and today I'm talking smile lines. Those pesky lines at the edge of the mouth, and they're aging. It's one of the first things that people see next to the under eye, and it really bothers them. What's new for the year ahead? What's coming? Also, what you should avoid, what you can do at home. Going to talk a little bit about exosomes today and their function, something that may shock you about those, and also RF, what you can do at home for RF, but also in your clinics to make sure you don't lose facial fat because you could look too gaunt. Now, for some of you, you've tried many things, they aren't working, so I'll give you some more extreme options also at the end. I'm going to give you exact prices on everything, and remember, I'll put a timeline below to save you time. Use the chapters. And remember, that inverted triangle becomes the pyramid of age. We want the triangular shape, so I'm going to tell you what you can do today to maintain that shape. I value your time. Let's dive in. So one of the things in 2024 that brought this to the forefront was Ozempic. People are losing a lot of weight and they're seeing it on their face and body. That causes smile lines, and then of course thinning of the skin. And that can occur for many reasons. Photo damage from the sun, also estrogen loss as hormones change. We get thinning of this area. And the worst part of this, you guys, is that it occurs often when people smile. And that's what drives them to my clinic, because they go, hey, I'm happy, I'm smiling, I'm out, I'm at dinner, and I'm seeing the lines at the edge. So the first thing you want to think about is prevention and your skincare. To that end, of course, SPF, covering, protecting, umbrellas. When I'm in Asia, of course, people are wearing gloves, holding an umbrella, and when they're waiting for trains and public transport, they're covered by shelters. Sun affects this area greatly, and a lot of people forget to put their sunscreen and reapply in the lateral face. Photo damage is a top killer of your collagen. Let's move on to the treatment options, and here retinols and glycolics win the day. You need to moisturize after you use these two because they can be drying. And here's the mistake people make. They use retinols. Some retinols do have moisturizers in them. Mine does, and I prefer those that are more moisturizing to negate the effect. The reason is people come off of the retinols or their glycolics because they say, I'm getting worse. But really they're getting dry. What compounds this? A lot of the people who get these are having hormone changes. Females, of course, are 90% in my clinic, so we only have 10% males. That's quite indicative of the aesthetic market as a whole. So a lot of people coming in for these are females. Men also have testosterone, and that protects the skin, so they're less likely to get smile lines. So as hormones go down, they take more retinols, more glycolics, the skin is drier, and you need to hyper moisturize. You see the dry skin from that double whammy of the hormone change plus the glycolic and the retinol fools people into thinking that they're getting worse when all they need to do is moisturize and get over that hump. Please don't be fooled. You'll miss out on one of the easiest ways to address this problem, particularly if your retinol does not, or your glycolic is not a moisturizing type. You want to think about ultra moisture type of products. You want to think about Korean style sheet masks. I know a lot of people don't like to use Aquaphor or Vaseline. It's more of a glass skin hack. Remember, those are highly refined. They're safe in practice, and I use them after CO2 lasers. They're used after surgical procedures for wound healing, and I know many of you feel differently about those. And you don't have to go to that extreme, but you get the idea. Moisturize. Another cream you're going to want to think about here that works extremely well is something with Volufiline. Now you can get this on its own. I have a product that contains it, also has a little retinol in it, and it has THD ascorbate, a more stable, fat-soluble form of vitamin C. So look in your products and see, you might have THD ascorbate. More and more people are adopting that, but Volufiline is a lipofilling style product, and you want a little bit of filling over here that can plump a little bit. It's not going to give you too much where you're going to lose your beautiful zygomatic angle or your high cheek, but enough to fill a little bit. I will talk fillers in a moment. So cost, for each one of the treatments I'm going through, cost, skincare. So you guys know the cost of skincare pretty much, but it's going to be the least expensive way to treat these. And of course, prevention, your sunscreen's always number one for that, or blocking light if you don't like sunscreen. And I have a whole video on sunscreen and the chemicals in sunscreen if you want to watch that. But some of you don't use sunscreen, but this is the least expensive way. But first, let's go on to skin boosting. This is all the rage in 2025 here. Now, the beautiful thing about skin boosters for this area is that they can be used in a fashion where we do not volumize. We don't need to add volume. You never want volume in the lower face. The inverted triangle of beauty becomes that pyramid of age. So why would you add anything to the lower face? And yes, this is going to be important when I talk radio frequency and RF microneedling. But for the skin boosters, we don't want to add volume. We want better skin. So when you smile, you don't get the lines. Think about ones like this. And I know these are crazy names. Some of you might be saying, Rajani, I don't even know what you're talking about. And others are going to say, I know them. Certain areas, you'll see these in this country, even though they're not FDA approved. They're microneedled in. And think of a place like Florida, Miami, Fort Lauderdale, you might see these. Areas in Texas, Dallas, Houston, definitely California, they're all over there. Think Profilo, okay? Not FDA approved in the US. It might be microneedled in, non-cross-linked HA. Think Guri, PCL, polycaprolactone, not FDA approved in the USA, and so you should not see that injected here. Regeran, which is salmon sperm DNA. That's more in the news. You see that. I like that. I've been to the factory. I saw the run and how it's made. Now, someone asked me the other day, actually, in the comment section, why is it salmon sperm? Well, the polynucleotides, the building blocks of your RNA and DNA, which is what this is very close from the salmon to the human. Sure, there are other sources. Why wouldn't you get human? Well, that's a whole other question that you guys can answer in the comments below. But salmon sperm facials are all over. And I think it was Kim Kardashian that was in the news. Of course, that's LA. So there you go, like I mentioned. There's Sonicos. Also, Lanluma, people ask about, again, non-FDA approved. It's not in the United States as approved. They are applying for it or have applied. It takes about 3 years. But that is the same as Sculptra, just a different dose. If you look what's in the vial, it's the same as Sculptra. So cost, skin boosters. Think about 4 sessions. I think, honestly, when you come in with lines and you're going to say how many sessions, for most people with things like Regeran, especially Sonicos, think about 4 sessions. When you go to something like Guri, 2 or 3 sessions might work. That's PCL, polycaprolactone, and Profilo, 2 or 3 sessions, and then you'll get one every 6-7 months. Each session of those is roughly $200 to $400. What about Sculptra as a biostimulator? Absolutely. Here's the thing. Think concentration. I did the first talk on stage when they got their glow indication, but then they also had submalar indication with it. And I didn't even know. It's a funny story. I didn't know I was able to talk about it until 10 minutes before going on stage, and they got the approval. But why do I mention that? Because when things are FDA approved, companies, and when you're in certain type of talks, like when you're talking for a company, you can't talk about all the way we use it differently. That's called off-label, and that's the reason that you watch channels like this, because we can talk frankly about what we do with real patients in real life. And the way I use it differently in the lower face is different dilutions. So just because you have Sculptra or Lanluma, and by the way, Lanluma is a much higher dose in the vial. That's all it is. It's a high-dose Sculptra in the vial. But Sculptra, you can concentrate and you can dilute. I use dilute Sculptra down here, and I add platelet-rich fibrin, which is your own blood, exosomes, secretomes, and growth factors. So it's more cost-effective for my patients, and I get more boosting. So you see how complex this all is, and where you go, the clinic you choose, will determine the result you get. Keep this in mind, not with Sculptra or Lanluma, but the other ones I mentioned. You need 2, 3, 4 treatments in a row. Watch my videos when I'm in Korea. They do hurt a little bit because it's superficial nappage mesotherapy injection technique. Now, things like Sculptra, you don't need a lot of product. Remember, I said it's dilute Sculptra down there. So if you're just addressing that area, that's about $600 to $1,000, and you'll get about 2 sessions. What's my dilution? Down here, it's about 18 to 1. For those in other countries outside of Canada and USA, Lanluma, about the same price as Sculptra. Lanolin is actually made from by a company that I work with called Sinclair Medical. Now, let's talk fillers for a moment. So fillers are not a choice of treating smile lines. Could you dilute them and inject them superficially? Sure. Could you take each individual line, inject it? Sure. It's not cost effective. They add volume. We don't want volume in the lower face. It's not the tool. Why are you seeing people do it? Because they don't have other tools in their toolbox. Keep in mind, every nurse, medical provider, whatever it is, I go to different countries, different hospitals, even within this country, I feel like a rock star. I walk in, everyone wants to learn about this stuff. When you go into the regular medical places, everyone wants to get out of medicine and do aesthetics. It's like, oh my gosh, how do I do this? That means there's a lot of less trained, untrained, whatever adjective you want, people out there injecting this kind of stuff. And so you got to be careful who you see. And all they know how to inject is filler. So if the only tool in your toolbox is a hammer, you go to build a house, everything's going to look like a 2x4 with a nail. And of course, you can't build a house that way. So same with your face. Know who you see. See an expert that has many tools in their toolbox and make sure they've done hundreds. Let's go to RF. RF is great. And you can now do it at home with radio frequency. I don't want to cover that today, but here's a look of an at-home device, and I have a whole playlist I'll put up here of how you can use this RF device that has built-in facial fat saving mechanisms to treat this area. But I want to talk about RF microneedling, and there's so much confusion in the comments. Here's why. Does it work? It does work for these lines over here. Is it the best treatment? No. But if you're getting RF microneedling for other reasons, then treat this area. That's what I do with my RF microneedling. And what do? I treat superficial, not deep. Yes, RF microneedling in the clinic, you can get rid of fat. And I love that I can get rid of fat. Here, underneath here would be two areas that I use it to get rid of fat. But I can change the settings to maintain fat and just go to the skin level. How? You can alter all the settings on the device. Remember I said see an expert? Great. This is why. I can change my pulse duration, so how long the heating is. I can change the joules, the amount of heat that I put in there. And I can change the depth. So I don't want to go deep if I want to maintain my fat. If I want to get fat, I go deep. How deep? 3.5 millimeters to 1 second duration. One of the best devices out there is the Profound for the deepest, longest duration if you want to get rid of facial fat, and also the Infini. So Lutronic makes an Infini, and you can go 3.5 millimeters deep for a 1 second pulse duration and get rid of fat. So understand RF, you can use it to get rid of fat, and you can use it to maintain fat and tighten skin. I like it. I do recommend doing it at home with the device, the Nua device. I have videos on how to do that because there's built-in safety mechanisms to keep your fat. You do not want a device at home, and I know many of you buy these home devices off these sites, but we've tested them, and the heating is erratic. You will lose your facial fat. So stick with a device like this one. Whatever your favorite device is, comment below. RF microneedling, think about $1,000 per session, $1,300 per session, and then you get a package of 3. It'll be $1,000 per session. So a package of 3 would be around $3,000. That would be normal. How many treatments do you want your professional to have done before you sit in the chair? A couple hundred. Don't be a guinea pig for these procedures unless you're willing to deal with the consequences. Not dealing with RF microneedling, but I just literally had a call from someone with a complication from a filler under the eye, and it was a training. I asked several questions. Did you use a cannula? How deep was it? What product? And they didn't know. So this is what's happening out there. I said, I can't really help you unless I know the answer to those questions. And it was in a training. Things can and do go wrong. Be safe. Let's move on. And remember, microcurrent is not RF. Many of you have microcurrent devices and you're confusing them with RF. I'll do a complete video on that. Microcurrent works on the muscles, as you might imagine, to help with tone. Now let me talk about 2 other treatments that you can do at home that are very effective. Number 1 is red light. your red light type of a mask, which I prefer because the lights sit right on your skin. You know the dose that you're getting. People who use panels still use red light masks for the facial region, but this area is covered well by most masks on the market. Of course, I designed mine so it covers the under eyes, the jowl, and the lip lines better, but almost all masks cover the side here. What you want to watch for is you don't want a poor, cheap mask that produces heat. You do not want heating in your LED mask. And by nature, an LED mask at 630, 830, they should not produce heat. You're going to feel heat because you're going to reflect your own body heat back through the mask. And I do not like wavelengths over 1,000 nanometers. We do not see benefits. In fact, there are downsides. I can do a video on that later. Cost of an LED mask, think around $400 for a really good mask. It's going to last you a long time. It's not going to give off heat. And the bulbs are going to be medical grade, and the product's going to be made of a medical grade material. A mask like that will be tested and certified from the factory. The other great option you can do at home is microneedling. Simple derma roller with growth factors works really well. If you don't have the money to get those things, or you just want to do dry microneedling after you cleanse your skin, a 0.25 to 0.5 millimeters is all you need to go. It's fairly simple. It works well. Be patient. Do not microneedle in your retinols or your glycolics. However, after microneedling, you can apply a retinol or glycolic. I like to wait 30 to 60 minutes. It depends how deep you're going. And of course, depends on how thin your skin is. The thinner your skin, 0.25 millimeters pretty deep. The thicker your skin, like a male skin or preauricular skin that's a little thicker, 0.5 to 0.75 is not that deep. So remember, it's not that easy. I'm going to do a free course all about microneedling for the new year, step by step how to do it. I'm going to try and carve out the time and get that. So stay tuned and wait for that. The cost of a derma roller, for a good one that you're going to trust the source, think about $25. I know many of you buy them under $10, under $8. If you have a good source, fine. Be careful. You want sterile, so it's not used prior, and you want the needles to be good so they don't break off in your face, and you need them to be pointed in the right direction. If they're all crossed up and everything, you're going to tear the skin. So it is important to use a good derma roller. 2025, I'll have a solution for you for that. The ones on my site are medical grade. Now, while I'm talking microneedling, I have to talk exosomes. I use exosomes in practice. I like exosomes, but here's what most people don't know. Exosomes, most of them are imported from other countries. The number one and two country that we see in United States used exosomes is Korea and China. Now, exosomes are small particles, 100 to 150 nanometers in size max, and they're communications between cells. So a cell makes its exosome to communicate with another cell. It contains microRNA, and we now know also DNA and RNA. So an exosome comes from other people, most commonly bone marrow, fat, placenta, amniotic fluid, and of course they're transported, now you know, from other countries here mostly, and they have to be, some are freeze-dried, some are not. We don't know what the right dose is. They want to say, I got 5 billion, I got 15 billion, but is that good? We don't know, and the reason is exosomes not only carry great signals for skin, for angiogenesis, so for the growth of vessels, they also carry signals that cause inflammation. Exosomes between cancer cells, that's how they communicate. So there's good and bad exosomes. So be mindful. Many people get exosomes. They don't realize they come from other people. They often aren't made in the USA. You may or may not have a problem with that. But when you start importing things, a lot of people try and import the cheapest thing. And you know corners are cut. And it's a corner cut on something that contains genetic material. So I can go deeper into that. But just be mindful when you get exosomes. These will be refined in 2025, and we will have something better that will change the market. But for now, many of you ask me about exosomes. Comment below what your main questions are. I'm happy to answer more. I know a lot about exosomes.